Hello, my name is Dr. Robert J. Bates. I am a physician trained in general surgery and urology, which is a subspecialty of general surgery. I was born and grew up in Chicago. I trained at the University of Chicago and did my general surgery and urology training at the Massachusetts General Hospital in Boston, Massachusetts, which is a hospital of the Harvard Medical School. So I came here in 2020 to help this new critical access hospital start specialty services, specifically urology. And over the past few years, we have built a urology practice that is serving this community and serving the community out quite a ways. If you're not familiar with what a urologist does, we are basically general surgeons that have specialized in urologic care. So that involves treatment of diseases and conditions of the kidney, the bladder, the prostate gland, testicular issues, testicular cancer, fertility. Vasectomies is a big part of the urology practice. So we deal with kidney cancer, kidney stones, bladder cancer, prostate enlargement, and incontinence, so leakage of urine in men and women. We also will see pediatric patients that are most of the time born with some sort of congenital issue or develop issues such as incontinence as young kids or bedwetting or bladder infections, things of that nature. So one of the beauties, I think, of trying to deliver kind of basic specialty care in a rural hospital like this is that we're here. You're not going a long distance, and the services are there. And I view this practice as an endpoint for patients. They can come in and receive all their care here conveniently in a local area. They're not driving, they may drive an hour, but they're not driving 3 or 4 hours. Being able to come to a community like this and getting to know people in the surrounding areas, and that goes quite a ways out, okay? It just makes you feel wanted, but more importantly, appreciated. I just have the experience of being in a big city where you can establish those relationships, but it's a lot harder. But here, I can talk to people that come in, mostly men, talk to them about their calving, or how their harvest is going, or all these people that work in the oil field. I know enough about oil production now to be dangerous, but I have a connection with them, and you just sometimes don't get that in a big, busy practice where there's all sorts of people between the patient and the physician. And that's what I treasure in these kinds of situations, that a lot of the other stuff is not there, that clouds that relationship. So if I do see somebody, or somebody says, Doc, you can go bird hunting, I got all sorts of birds, okay? It's that kind of thing that really, in my stage of the career, more important sometimes than the services I'm delivering, to have that relationship. It's comprehensive care close to home by people that are confident and capable of providing it, and then the ongoing care that goes on after that.